Buzz buzz, motherfucker. Bury the bee. Buzz buzz is the only thing keeping me from crashing out right now because I'm in pain. You know something goofy? Endometriosis. Whole thing. Goofy. You know why it's goofy? Because it's a chronic illness, a disability where your uterus-like lining, endometrial tissue, grows outside of your uterus. So it grows on your abdominal cavity. It can grow on your pelvic organs. Huh? And a big issue with endometriosis is that symptoms are often ignored or just misdiagnosed or attributed to other things like painful sex, painful irregular bowel movements, heavy periods, irregular periods, all types of things that women are usually told it's hysteria or you're stressed. No, baby, it's real. It's real. It's a condition. Don't get me started on chronic fatigue and inflammation too. My joints are swollen. My back is swollen. My knee is squishy right now because it got fluid in it. I'm 29. The entire illness is also broken down in 4 stages. If y'all ain't know, I'm about to put you on. Stage 1, they classify it as minimal. You will have little to no scar tissue. There are probably a few small implants. However, just because it's stage 1 and it's called minimal, that doesn't mean it don't hurt you the same, baby. The stages have nothing to do with how it affects you, and I want you to remember that. Stage 2, it's called mild. There are possibly more implants present than in stage 1. There's potentially minimal scar tissue. Again, don't matter. If you got it, you got it. It still hurts the same. Stage 3, they call it moderate. You will have deep implants present. You might have endometriomas, which are cysts on your ovaries. You have significant scarring, and it hurts. Stage 4, severe. This is where you have large endometriomas, again, cysts on the ovaries. It might be on one, it might be on both. You have significant scarring. You got big old, deep old implants everywhere. And it hurts. It all hurts. I want to emphasize again that this stage does not correlate to the severity of what you are feeling and how serious your symptoms should or should not be taken. That don't even matter. It's the fact that you got it, or you might suspect that you have it. That is what is important. And endometriosis is a very complex, very, very underfunded, understudied, and misunderstood chronic illness. And there are a lot of myths and misconceptions that delay diagnosis, which is a whole part of the problem. Let's get into it. I don't know how many times I went to the doctor talking about my problems, and they're talking about, well, you know, this will probably go away when you get pregnant. Pregnancy will make it better. How do you think I'm supposed to be worrying about carrying a baby? I can't even carry myself to the bathroom. Come on. I also used to hear a lot that I couldn't possibly have endometriosis because I've never had a baby. That is a lie. It affects people of reproductive age, not just people who have already reproduced. Please do not get medically gaslit into thinking you couldn't possibly have it because you are childless. That is wrong. Another myth is that a hysterectomy cures endometriosis. There is no cure. It is a chronic lifelong condition. There are management treatments, which include a hysterectomy. I myself am getting one in February because I'm just done, and I'm just done. Yeah, so like removing the uterus, removing the tubes, even those who get their ovaries removed as well, it isn't like a magical cure-all, but baby, it's gonna help something. I'm putting my faith in my doctor to get as much endometrial tissue as he can. Hopefully he gets all of it, and we're just gonna go from there. If you have been newly diagnosed, if you suspect you have it, If you do have it, you want to learn more, you want to talk about it, baby, this for you. We going through this together. And Barry the bee is here with us. Bzz, bzz. Like, comment, subscribe, follow for more. Save this video for future reference. Have a good day, baby. Me and Barry is out.